Right now, as you're watching this video, somewhere between 30 and 50% of all cancer deaths could have been prevented. Read that again. Up to half of everyone who dies from cancer didn't have to. In 2025, over 2 million Americans will be diagnosed with cancer. More than 618,000 will die from it. That's more deaths than COVID caused in most years. It's almost twice the number of heart disease deaths. And yet, we rarely talk about it like the epidemic it is. But here's what really keeps researchers up at night. Only 5 to 10% of all cancers are caused by genetics. That means 90 to 95% have their roots in your environment. Your lifestyle. The choices you make every single day. In the next 15 minutes, I'm going to show you exactly what those choices are, the science behind them, and the specific changes that could literally save your life. But I have to warn you, some of what you're about to hear will shock you. Especially what I reveal in part 4 about something millions of people eat every single day that the World Health Organization has classified in the same category as tobacco and asbestos. Let's begin. The shocking statistics. A groundbreaking study published in 2024 by the American Cancer Society analyzed nearly 1.8 million cancer cases. What they found changed everything we thought we knew about cancer prevention. 40% of all cancer cases, and nearly half of all cancer deaths, were linked to modifiable risk factors. That's over 713,000 cancer cases in a single year that could have been prevented. 262,000 lives that could have been saved. Let me break down what modifiable risk factors actually means. A. Cigarette smoking, responsible for nearly 20% of all cancer cases. A. Excess body weight, 7.6% of cases. A. Alcohol consumption, 5.4% of cases. A. UV radiation exposure, 4.6% of cases. A. Physical inactivity, 3.1% of cases. Diet and infections, the rest. Now, here's where it gets really interesting. For some cancers, the percentage that could be prevented is absolutely staggering. 100% of cervical cancers. 100% of Kaposi sarcoma. 94% of anal cancers. 92% of melanomas. Nearly 90% of lung cancers. These aren't small numbers. These are almost total prevention rates. So why isn't everyone doing this? Because, and this is what nobody tells you, the things that actually prevent cancer aren't sexy. They're not pills. They're not miracle supplements. They are boring, everyday habits that compound over decades. And that's exactly what makes them so powerful. The number one cancer killer. Let's start with the elephant in the room. Tobacco. If I could only give you one piece of advice from this entire video, it would be this: if you smoke, stop. If you don't smoke, never start. Here's the brutal math. Tobacco causes 25 to 30% of all cancer deaths. Almost 90% of lung cancer patients are smokers. 344,000 cancer cases every year are directly caused by cigarettes. It's linked to at least 15 different types of cancer. But here's what you might not know: when you combine smoking with alcohol, the effect isn't additive, it's multiplicative. The two substances work together synergistically to damage your DNA. Think about that. It's not 1 + 1 is equal to 2. It's more like 1 + 1 is equal to 5 or even 10 in terms of cancer risk. But here's the good news that nobody talks about enough. The moment you quit smoking, your body starts to heal. Within 20 minutes, your heart rate drops. Within 12 hours, carbon monoxide levels normalize. Within 1 to 9 months, lung function improves. Within 5 years, stroke risk drops to that of a non-smoker. Within 10 to 15 years, lung cancer risk is cut in half. Your body wants to heal. It's just waiting for you to give it a chance. Foods that causes cancer. Remember when I mentioned something the World Health Organization put in the same category as tobacco and asbestos? I'm talking about processed meat. In 2015, the International Agency for Research on Cancer reviewed over 800 studies. Their conclusion was definitive: processed meat causes cancer. Not might cause. Not is associated with. Causes. Now, before you panic, let me explain something important. Being in the same category as tobacco doesn't mean processed meat is as dangerous. The classification tells us about the strength of the evidence, not the level of risk. But here's what you need to know. Every 50 grams of processed meat you eat daily increases your colorectal cancer risk by 18%. That's about one hot dog, a few strips of bacon, a handful of deli meat. The mechanisms are terrifying when you understand them. The 3 ways processed meat damages your DNA. 1. N-nitroso compounds. When you digest processed meat, chemicals called N-nitroso compounds form in your gut. These compounds directly damage the DNA of cells lining your colon. 2. Heme iron. The iron in red and processed meat, called heme iron, triggers oxidative stress and DNA damage in your digestive tract. 3. High-temperature cooking. When you grill, fry, or smoke meat, carcinogenic compounds called heterocyclic amines and polycyclic aromatic hydrocarbons form. These are potent mutagens, meaning they literally mutate your cells. Now, I'm not saying you can never eat bacon again. But the research is clear: the less processed meat you eat, the lower your cancer risk. Cancer Council Australia recommends cutting out processed meats altogether or keeping them to an absolute minimum. Red meat should be limited to no more than 1 serving per day or 2 servings 3 to 4 times per week. The factor nobody talks about: here's something that might surprise you. One of the most powerful cancer prevention tools isn't something you do, it's something you're supposed to do for 7 to 8 hours every night. Sleep. A study of over 23,000 middle-aged adults found that people who slept less than 6 hours per night had a 43% higher risk of cancer compared to those who got 7 to 8 hours. 43%. From not sleeping enough. The World Health Organization has even classified night shift work as a probable carcinogen because it disrupts your circadian rhythm, your body's internal clock. Here's why this matters. When you sleep, your body produces melatonin, a hormone that doesn't just help you feel drowsy. Melatonin has powerful anti-cancer properties. It helps regulate your immune system and controls cell division. When you're sleep deprived, your immune surveillance weakens, meaning cancer cells can slip past your body's defenses. Inflammation increases, creating an environment where tumors thrive. Insulin resistance develops, which promotes cancer cell growth. Natural killer cells become less effective at destroying abnormal cells. Research from Johns Hopkins shows that disruptions in your body's biological clock can increase your odds of breast, colon, ovarian, and prostate cancers. Think about that the next time you stay up scrolling through your phone at 1 a.m. The silent killer inside you. There's a silent killer living inside most of us right now. It's called chronic inflammation. And it's being fueled by something you experience every single day: stress. A 2024 study from Cold Spring Harbor Laboratory made a terrifying discovery. Chronic stress doesn't just make you feel bad, it physically changes your body in ways that help cancer spread. When mice were exposed to chronic stress, they showed up to a 4-fold increase in cancer metastasis. Here's how it works. Chronic stress triggers your hypothalamic pituitary adrenal axis. That's your body's stress response system. This floods your body with hormones called glucocorticoids. These stress hormones cause certain immune cells called neutrophils to form sticky web-like structures that make your tissues more susceptible to cancer cells taking hold. In other words, stress is literally preparing your body to receive cancer. The researchers found that chronic stress modified lung tissue in mice even before they had cancer. As one researcher put it, it's almost preparing your tissue for getting cancer. Now, I know what you're thinking. Great, now I'm stressed about being stressed. But here's the empowering part. The same study showed that when they blocked the stress pathway, the increased metastasis disappeared. Stress management isn't just about feeling better. It could be a matter of life and death. The cancer vaccine that already exists. What if I told you there's already a vaccine that can prevent cancer? Not in some distant future. Not in clinical trials. Available right now. I'm talking about the HPV vaccine. A landmark study of nearly 1.7 million women in Sweden found that girls vaccinated before age 17 experienced a nearly 90% reduction in cervical cancer. 90% reduction. That's not a typo. In Scotland, Researchers found 0 cases of cervical cancer among women vaccinated at ages 12 to 13 after 8 to 12 years of follow-up. The HPV vaccine doesn't just prevent cervical cancer. It protects against anal cancer, throat and mouth cancers, penile cancer, vaginal and vulvar cancers, genital warts. The vaccine is recommended for everyone ages 9 to 45. And here's something that surprises most people: boys need it too. HPV causes cancers in men, and vaccinating boys also protects their future partners. If 80 to 100% of people got vaccinated, researchers estimate we could prevent nearly 50 million cervical cancer cases by the year 2100. This is real. This is available. And tragically, vaccination rates remain far too low because of misinformation. The free medicine. There's a medicine that can reduce your risk of at least 7 different cancers. It's completely free. It has no negative side effects. And most people don't take enough of it. Exercise. Strong evidence shows that physical activity decreases your risk of colon cancer, 24% risk reduction. Breast cancer, 15 to 20% risk reduction. Endometrial cancer. Kidney cancer. Liver cancer. Stomach cancer. Bladder cancer. But here's what's truly remarkable: even if you already have cancer, exercise improves your odds. A meta-analysis found that breast cancer survivors who were the most physically active had a 42% lower risk of death from ANY cause and a 40% lower risk of death from breast cancer specifically. How does exercise fight cancer? Multiple mechanisms. It lowers sex hormones like estrogen that can fuel certain cancers. It prevents high insulin levels that promote cancer growth. It reduces inflammation throughout your body. It enhances immune function and activates natural killer cells. It helps maintain a healthy weight. The recommendation: at least 30 minutes of moderate to vigorous activity on 5 or more days per week. That's a brisk walk, a bike ride, a swim. It doesn't have to be complicated. It just has to be consistent. Your cancer prevention checklist. All right. You've made it this far. Let me give you the complete cancer prevention checklist, the specific, actionable steps that science says can dramatically reduce your risk. The complete cancer prevention checklist. 1. Never smoke. If you do, quit today. It's the single most impactful thing you can do. 2. Limit or eliminate alcohol. There's no safe level when it comes to cancer risk. Less is always better. 3. Maintain a healthy weight. Excess body fat is linked to 13 different cancers. 4. Eat whole foods. Fill your plate with vegetables, fruits, whole grains, and legumes. Minimize processed foods. 5. Cut processed meat. Eliminate or drastically reduce bacon, hot dogs, sausages, and deli meats. 6. Move your body. 150 minutes of moderate exercise per week. Walk, swim, dance. Just move. 7. Protect your skin. Use SPF 30+, avoid tanning beds, seek shade during peak sun hours. 8. Get vaccinated. HPV vaccine for cancer prevention. Hepatitis B vaccine to protect your liver. 9. Prioritize sleep. 7 to 8 hours per night. Your immune system depends on it. 10. Manage stress. Meditation, exercise, social connection, whatever works for you. 11. Get screened. Early detection saves lives. Know when to get colonoscopies, mammograms, and other screenings. Look, I know this is a lot. And I know you can't change everything overnight. But here's what I want you to remember. Cancer is not inevitable. It is not purely bad luck. And for many people, it is preventable. Every small choice you make, every cigarette you don't smoke, every walk you take, every hour of sleep you prioritize, is a vote for your future health. You can't control everything. But you can control more than you think. If this video helped you, please share it with someone you love. Cancer prevention isn't just about saving your own life, it's about being there for the people who need you. Hit that subscribe button if you want more evidence-based health content. And drop a comment below telling me which change you're going to make first. I'll see you in the next video.